I'm Dr. Rosalyn George with Wilmington Dermatology Center, and today we're going to be discussing Ulthera. Ulthera is one of my favorite procedures. We've been doing it since 2011, and we are the top provider in North Carolina, so we have a lot of experience, and I think it speaks to the results we've been getting with our patients for years now. Actually, just I'm starting to have my patients come back that are needing their second treatment. So what Ulthera is it's an ultrasound device that uses high-intensity focused ultrasound to gently heat the deeper tissues, minorly injuring them so that you regenerate new collagen. And so much of what's happening as we age is that our face is losing elasticity and collagen. There are other things that are going on that can be addressed with other procedures that we'll talk about in another blog. But this one is doing the laxity. So when you go down like this and you start to see this little bit of change, it's really best for mild to moderate laxity. I certainly do have people with more severe laxity that maybe would be better suited for a facelift who will do multiple treatments of this and still get some good results. But the best patients are those with mild to moderate laxity. And what you can see here is that this is the area that's treated. So you can do a full face. It's great for neck. It's actually FDA approved for chest lines too. Lifting and tightening along the jawline, and also lifting along the brow line. So people nowadays really don't want to have a surgical procedure. They want to come in, they want to have a lunchtime procedure with minimal to no downtime that provides results. And more natural results. Nobody wants to look like they've had something done. And that's one of the great things about this. It's a gradual process. You see the results over 3 to 6 months. About 90 days you'll see some of the results, but I really tell my patients about 6 months to see all of the results. And another nice thing about it is we actually can see where we're treating, so it just makes the side effects really non-existent in most times, because we can see where there might be bone that we don't want to treat over because we don't want to get any nerve damage, and that's one of the best things about it. The other thing is that you're kind of treating at different depths, and so what's happening is that our skin underneath is like a lattice work, and it starts to get disorganized over time, and just by gently wounding that lattice work is kind of regenerating itself. So it takes a little bit of time to see those results. I'm seeing patients of all age ranges starting this. I'm seeing lots of patients in their late 30s, early 40s, up until 65 is the FDA approval. After the age of 65, we don't have as much collagen regenerating properties in our skin, so I think it takes a little bit more energy to get the same results. However, if somebody's taking good care of their skin, I certainly have people that are in their 70s that do really great with this procedure, but as a case-by-case basis. I'd say the best patients are those between the ages of 45 and 55 that have mild to moderate skin laxity. The treatment takes about an hour, and it's non-invasive. Most people can come in, have the treatment, and go directly back to their work, or their life, exercise, everything without having any downtime. The treatment is a little bit uncomfortable, and so in our practice we do a little bit of minor numbing around the treatment area so that it's much more comfortable for the patients. And I have to say, it's made such a big difference. When we first launched it and just did the procedure without any numbing, people were very uncomfortable. Just adding that little tiny bit takes the edge off.